listening to Development Works, produced by Doctors for Doctors and Nurses for Nurses. Hello friends, I'm Andrew Wilson.
And I'm Michael Carlson. This Development Works supported by Doctors for Doctors and Nurses for Nurses.
And on today's upcast, before doing international development, you should learn about the Voluntourism Placebo.
We hear from Dr. Lawrence Lowe, an MD who runs a nonprofit dedicated to the idea of supporting volunteering the right way.
Dr. Lawrence Lowe is co-founder and direction of partnerships and advocacy operations at the 53rd Week, an adjunct professor at the Della Lana School of Public Health and University of Toronto. His research has explored strategies and models around responsible approaches to volunteering abroad, as well as evaluations of partnerships developed by 53rd Week in Eastern Dominican Republic. Dr. Lowe completed undergraduate training and medical school at the University of Western Ontario and his residency at the University of Toronto, during which he also earned a Master's of Public Health at Johns Hopkins. Today on the Upcast, Dr. Lawrence lets us know what worked in international development.
But first, this Upcast is powered by Doctors for Doctors and Nurses for Nurses. We're a Canadian charity that sponsors the medical education of high-potential youth in rural Nicaragua. If you want to ensure everyone has access to quality health care, first, visit doctorsfordoctors.ca.
I often begin a lot of these talks with global health and development interested folks by pointing out that I was part of probably the generation that really ruined it for everybody. When I was an undergrad in the late 90s, early 2000s, most people didn't actually go abroad. You know, there were volunteering requirements. People would start to go abroad, and it was seen as the coolest thing to do. Basically, there were no questions asked. It was just like, you're going abroad to help. It's fantastic. You must be doing great stuff. And very often, I actually explained to people that we were kind of like Rambo running roughshod in a lot of these villages, just going in and basically saying, "You're going to be developed," and just like, ignoring every semblance of community needs or community beliefs or values or understanding anything there. And so, my beginnings actually started in medical school as a third and fourth year medical student, where a friend of mine started going abroad to the Dominican Republic. He was actually in Kansas City. I did my medical school at the University of Western Ontario. And in the course of actually going abroad, he started piquing my interest in joining him at some point or another. I actually did undergrad and med school at Western before completing residency in public health and preventive medicine at the University of Toronto. And when I got into the public health and preventive medicine residency program, my friend said, "Hey, you're the public health guy. I got to ask you a question. I don't know if what I'm doing abroad is actually helping people." And I said, "I don't know. Sure, I'll come with you on one of these trips." And so we went on one of these traditional, head out to the Dominican Republic, go to some local hospital, bring a bunch of Tylenol and vitamins and other sort of pills out to some village and run what I call a bit of a sham clinic, and then come back and try to feel good about ourselves. I didn't feel good about myself at all. I actually felt somewhat unsettled the first time I did that. So much so that I went back again, not because I wanted to actually help, but because I actually wanted to see what was wrong with what we were doing. And also knowing that my friend was still going, so I had some questions. I soon coined the idea that what we were doing was the placebo of global health and development. The idea that we as volunteers felt good about what was going on, and the community, they would say that they felt good about what was going on, but nothing we were doing was actually addressing the root determinants of inequities that we were seeing in these communities. So the reality, though, is a lot of the criticism that you've seen around short-term volunteering has been uniformly negative, right? And I think that has actually been what has made it so ineffective in changing the tide. Short-term volunteering becomes more and more popular every year because a lot of people will look at the criticism and say, "But that's okay. I'm different. I'm not doing it in that way. I'm going with a group that says they're different. I'm going with a group that actually has responsibility plastered all over their website, even though they may not necessarily be so," right? So going back to the idea that telling people not to do something is not the way to get them to do it, we at the 53rd Week have tried to ask the question, what do we need to do to actually encourage responsibility and volunteering?
An international development volunteer trip in the 90s, Mike, I picture something like the Wild West,
Yeah.
The placebo of global development is a really interesting concept. We know about the placebo effect in medicine. Mm-hmm. It's the idea that you take a pill that's just a sugar pill, but because you think it's going to do something, it does. And, well, I guess Dr. Lowe is getting at here is the idea that entire communities and groups of volunteers are thinking they're better off for a volunteer going in and helping build an X or donating a Y. And everyone says it's helpful, but deep down, it's probably not as helpful from any metric that we could measure.
And the part that blows my mind on this placebo effect is that short-term volunteering is on the rise.
Yeah.
So now we have, in general, we've used all sorts of ways to describe that phenomenon. So we call it volunteering in a different country, or voluntourism, or going overseas, or traveling abroad. There's so many different ways to name it. But it's super interesting to me that Dr. Lawrence Lowe describes it as short-term volunteering.
Yeah, I think it's the most neutral way to say it, like a scientific way to define what it is. For example, I know that when people talk about voluntourism, it's often used quite negatively.
Yeah, it can be like an insult, like you voluntourist.
Yeah.
Get out of here, sort of thing. But the idea that really connects with the harm of the whole concept, I think, is this short-term element, short-term volunteering, and I think that's getting at short-term means that things are not sustainable. It's just harder to make things sustainable if they're shorter term.
Yeah, I think you're right there. In this next clip, Dr. Lawrence tells us about how to treat short-term volunteering to make sure that we get it right when we go abroad. Now listen up, it's more complicated than you think.
So out of all that came the creation of a nonprofit organization that was alluded to in the opening, which is called the 53rd Week. And what the 53rd Week is, in a nutshell, is a think tank that is actually trying to figure out what is the best way to actually volunteer. Recognizing that a lot of the times there is a lot of criticism about volunteering out there, but so far the criticism hasn't worked. I mentioned that I trained in public health and preventive medicine. What I can share with you is that every public health, any of you here in public health, by the way, or interested or having had worked in public health, all right. One of the first things we learn in public health is the least effective way to change behavior is to tell people not to do something, right? We tell people every year, don't smoke. And every year, tens of thousands of kids will try smoking. We tell people, don't drink and drive. We tell people, eat healthily. The reality is that to change behavior, telling people isn't enough. You actually have to create the context and create the setting which allows the right or quote unquote healthy choice to be the easy choice. Yeah, so the framework is actually really exciting. We are trying to get it published. It hasn't been published yet, but what I can tell you is it's basically targeting the thoughts of individual volunteers. So that means coming to talks like this and sort of sharing, my perspectives with individuals, trying to educate and train, but also targeting programs, groups that actually operate volunteering people. So trying to figure out, audit, what are good examples of volunteering? What are model sort of programs that we can actually say, this is a responsible way of volunteering. You're partnered with the local community. You're focused on longer term outcomes. You're not just coming in a la Rambo and running roughshod all of these places. And then also at the societal level, policy level changes that will actually change the way we think about volunteering. A good example that we're working on the policy level is admissions policies in professional schools. Tobacco is one of the best examples of how a complex problem was actually solved through a comprehensive strategy that targeted individuals, so things like smoking cessation programs, educational programs, actual programs where there was actual efforts to sort of evaluate smoking rates, try to figure out which typical groups were smoking, come up with data, all these other things. And then policy efforts to actually change the context that we're living in our society. Basically eliminating smoking in airplanes, in conveyances, then moving on to restaurants, then moving on to just sort of public spaces, et cetera. Even now to moving to specific outdoor places. So all of these things taken together, getting data, individual efforts, all these other pieces was really what has changed our societal view on smoking, and it's really made a difference. So we've actually, at the 53rd Week, tried to offer a similar sort of strategy for volunteering.
Wow, there is lots there. But let me start with the least effective way to change behavior, telling people not to do something. I love Dr. Lawrence Lowe talking about that. So, for example, let me ground it here. I can tell you, Andrew, to cut your hair because you look like a hippie. But Yes, I can tell you that. But based on the look that you're giving me, I would assume you won't cut your hair. In fact, you'll just grow it longer. And in a similar way, if we tell people to stop going to build houses or save turtles or whatever people are doing overseas, just leads to all of their friends wanting to do it too. So maybe all your friends want to have long hair now too.
So in the same way that I'm going to spitefully grow my hair, someone might spitefully go overseas and save turtles.
Yeah, spiteful saving turtles. Exactly.
It's a great charity.
Don't tell me not to save turtles.
Yeah.
I'll save all the turtles I want.
Spite turtles. If your friend's telling you not to save turtles, come volunteer with us. We'll make it a great time. It's like stop delivering babies in developing countries because they let you, or put the scalpel down. You're only an undergrad, and Mike, we've been shouting this for over a year now in this can, and I don't think anyone's listening on the other end of the string here.
Does that mean that no one's listening to our podcast? Our listenership is going up, right?
Yeah, I mean everybody's listening to it, but is it stopping people from going overseas, or is it increasing volunteering in spite turtles?
That's sad. We need to have more impact. But hearing Dr. Lawrence describe what 53rd Week does was so impressive. I love that organization, and especially the way he put it. They wanted to create the context for healthy choices to be the easy choices.
Yeah, and I can't believe there's an entire organization dedicated to coordinating short-term volunteering efforts to make them more useful. It's like an industry for an industry. It's the inception of volunteering, Mike.
Whoa, yeah. It's like 53rd Week is the inception organization for people trying to do good. So like one day they wake up, the people, the volunteers, and then they know how to volunteer overseas because Dr. Lawrence Lowe told them in a dream that how to volunteer, and all the while they actually think it's their own idea.
And then they do it responsibly. Yeah.
It's crazy. So in this next clip, Dr. Lawrence talks about the need for his inception techniques, aka everybody's ego is actually getting in the way of receiving feedback. Ego is such a common theme in our podcast. So maybe just being told that you're wrong is where we need to start.
The first rule of engagement in any regard is recognizing and coming in with a sense of humility, that it is actually a privilege, not a right, to enter these communities. From there, everything else flows, working with local partners, understanding local priorities, all these other pieces. But going in with the idea that it's a privilege and not a right to enter these communities is really the ultimate message that we should be spreading, and we should be trying to provide the incentives that actually allow people to recognize that in their work. And just like things like, on the topic of incentives, just like driving, which many people forget is a privilege and not a right as well, if you suck at it, it should be taken away. There should actually be mechanisms in place to actually say, you shouldn't go abroad, be it disciplinary action on the college, some sort of blacklist on immigration radars, whatever the case might be. There should also be those incentives that all form that part of that policy, program, individual framework that I was talking about. It's tough for policymakers to say, no, I'm going to regulate volunteers. These people that are going abroad and quote unquote doing good, can't possibly regulate that. Similarly, for us to come in and say, hey, we know you want to do good, but actually objectively there are a lot of reasons why what you think is good and how you've been doing things may not actually be good, makes the message a lot less receptive. People are less interested in receiving that message. No one likes to be told that they're not doing good when they're actually trying to do good.
I like the idea of a world where someone is not allowed to volunteer because they did something ridiculous.
It's beautiful.
Mike, can you imagine getting into a country and then being denied entry because you did some shabby volunteering in the past?
It'd be so funny. Like, why are you here? To volunteer. Oh, well, go home, you Canadian. It says here that you painted a shitty mural on the side of a barn in Dominican that no one liked for no reason. That made everybody take pictures of it. So now you're banned from Haiti. Super funny.
Yeah, after Dr. Lawrence's talk in the Q&A session, we spoke about the idea of creating a course for people to take before they go abroad, almost like what Patty did for scuba diving, so that they might learn what good and bad volunteering look like, but there was a key difference.
Mm-hmm. And so what was the conclusion of all of this? Well, basically, though it may seem like a good idea, it's impossible to have a course that encompasses the broad spectrum of volunteering. So let's just think of some different groups of volunteers, right? We got medical students over here. We got religious groups over here. We got us at DFD, which are going in and trying to build long-term relationships. And then we've got maybe folks that want to just go dig a well. Those are so different from one another. How do you write a course that encompasses all of the needs of those?
Yeah, and I guess we'll all have to keep working at this, so maybe one day we can regulate the individuals, the institutions, and the policies that can potentially put people in harm's way.
Ideally.
Dr. Lawrence, we really appreciated you coming down and speaking on our show, but don't take my word for it. Here's Gabby, the president of the University of Toronto Student Club, to give her 2 cents in a new segment we are calling Gabby's 2 cents.
Something that I really liked about Dr. Lowe was how engaging he was with the students in the audience. For example, he was critical of the idea that volunteering abroad is often seen as an advantage for medical school applications, when the reality is that many students who do go abroad to gain patient care experience often end up causing harm. On behalf of the Student Club, I would like to thank Dr. Lowe for giving such an awesome talk.
For all our listeners, if you want to hear everything that Dr. Lawrence or any of our other speakers for Development Works say unedited, you can always come to our live recordings at the University of Toronto downtown campus. Check out our website, doctorsfordoctors.ca, to find all the event details. Our Canadian charity strives to do the best international development possible, and as we continue to learn, we are sharing all our learnings with you.
And we'd love to hear from you too. So drop us a line on our website if you want to volunteer or get involved.
And now, updates for the month.
In Doctors for Doctors and Nurses for Nurses this month, Brian, our first ever sponsored medical student, just graduated to become a doctor.
Woo!
Congrats,
Yeah,
Brian.
Brian.
And he still has what's called a social service year through this year and will be practicing in his local community as a doctor. And this, of course, is a huge step for Brian, and it's also a really big step for DFD and NFN.
On our Canadian side, we're also taking some big steps. We just had our AGM over the whole weekend early this month, which was a great time to work, play, and get organized. So we did a few things. One, we completed our annual report, and we'll be releasing that soon, so stay tuned. And for the first time ever, when we did our financials, we aren't in the red.
Yes.
And Andrew and I are very excited about this. This is a new stage and a place as a young organization. It's very exciting. So all the work and direction is finally paying off. So thanks to everyone that's helped with fundraising over the years, and get in touch with us if you ever do want to volunteer with us.
Well, that does it for this month's update on Doctors for Doctors and Nurses for Nurses, and let's hand it back to Dr. Lawrence for the last word.
So, allow me to introduce myself. My name is Lawrence, and I am a recovering voluntourist, right?
And that's everything for this month's episode of Development Works. Thanks for listening.
This is Andrew and Mike signing off, and remember, if you don't make mistakes, you're not working on hard enough problems.